Hey guys. Hello, hello, hello. It's Dr. Jen. It is good to see you guys. Um, Welcome. Happy Thursday. While we're waiting for a few people to get on, by the way, we are talking about why men don't go to the doctor. This is a very important topic to me as a family doctor, and I hope it's important to you as people who likely have men in your lives. That's right. So hold on one second, YouTube. I know you guys are there. Let me just double check and make sure Facebook is in the house. Okay. Make sure they are here. I don't see them. Okay, hold on. Let me try this one more time. YouTube, hang in there, guys. Because sometimes it doesn't happen and I don't know why. Delete. Hey, guys. Hey, hello. Leslie, how are you? It's good to see you. Thank you guys for being so patient. Here, let me actually adjust this a little bit while we're waiting. So for those of you on YouTube that have just joined, I just needed to, Facebook didn't come up. So I'm just reloading. Okay, so give me 1 second. And should I say, why don't men, go to the doctor? Because actually that's the thing. It's really interesting. Very interesting. Okay, so let's try this again with Facebook and just sort of see. All right. Are we live? Are we live? Are we live? I know YouTube is in the house, and I love you guys for already being here. You are set and ready to go, which is awesome. I think we are ready to go with Facebook. I am just double checking. So what we were talking about today, as I was mentioning, guys, is we are talking about why men don't go to the doctor. All right, I see Facebook in the house. And I actually worry about making sort of general statements like this. I'm a family doctor. I see patients. I've been in practice for about 13 years or so, and I've seen a lot of patients, and I'm always reluctant to make generalizations. Like I'm always reluctant to say, "Oh, women don't do this, men don't do this, kids don't do that." White people don't do this, black people don't do this, right? You can see the problematic nature of assumptions about groups of people, right? And gender is included. And I've always been reluctant to even say things like, well, men don't like to go to the doctor. But I titled this Why Men Don't Want to Go to the Doctor because there actually have been studies that suggest that that is the case. So we're going on some facts, at least based on some surveys that have been done, evaluating and analyzing the behavior of men. So let me just talk to you about this. This was a Cleveland Clinic did a study, or rather they did a survey and found that 50% of the men in the survey, there was over 1,100 men in the survey, 50% of them, only 50% rather, got their regular checkups. Guys, that's a big deal. Only half of those men in the survey went to the doctor regularly for regular checkups. That's sort of evidence, at least one small piece, right? That in some cases, men may not go to the doctor or don't like to go to the doctor. There have been other studies and other things as well. Okay. But I just wanted to say that is kind of what we're dealing with. So we're going to talk more. We're going to break this down, talk about why men don't like to go to the doctor, talk a little bit more about what men would rather be doing than going to the doctor. And we're also going to talk about how to get our men to go to the doctor. By the way, guys, I'd love for you to comment, make comments about how you feel, whether it's going to the doctor, you like it, you don't, especially the men, but I want to hear from women too. Also, if you don't like going to the doctor, why? I'd love to hear what you think and how you feel. Just want to give a shout out to my YouTubers, Leslie George. It's great to see you. Brenda Lee, hello. Facebook is on the line. Rufus, thank you for the stars. Also, Dale, thank you for the stars. So appreciate you guys sending stars. Also, by the way, you might notice that tonight is Thursday night. I'm going to try to switch up the nights for lives. Usually I used to do them Friday and Monday. I'm going to try to switch it up to Thursday and Monday, just because now with everything opening up from a COVID standpoint, I think a lot of us may want to do things on a Friday evening rather than sit here and look at me. So we're going to give Thursdays a try, and then, of course, Mondays as well. So let me know what you think about Thursday evenings for lives. Samantha, you're watching from Guyana. It's good to see you. Rufus, hello. David Smith, thank you for the stars. It's good to see a lot of my superstars on the line, which is great. That's my subscription group on Facebook. Make sure you check it out. So let's just jump right in. Okay. So I mentioned Cleveland Clinic did a study, and they found that of over 1,100 men that they surveyed, only 50% of them got regular checkups. But not only that, but in the same group, 2/3 of the men would admitted to waiting as long as possible to see the doctor about whatever issue they had. So there were men in the survey that even admitted to waiting as long as they possibly could before going to the doctor to be checked out, to be checked up about something. In addition, the men in the survey, 70% of them said they would rather do household chores than go to the doctor. And I want to know, are we really that bad? Are we really that horrible? I don't know. Maybe we are. You never know. Me and my Coke Zero, by the way. Everything in moderation, my friend. So anyway, but not only that, I have one more thing to note, which is that 20% of men in the survey admitted to not being completely honest with their doctor. I think those are really, really important jump off points. Okay, so let's start from that. So these are some things that we know. And again, that's just one survey. Okay, but it seems pretty clear that there are many men who are just not going to the doctor as much as maybe they should, or are not comfortable seeing a doctor, would rather be doing other things than seeing their doctor, would perhaps may not tell the whole truth if they weren't comfortable doing so, etc. So first of all, let me also say that there's, again, many other studies, plenty of other reasons why people may feel this way. Men on the line who are watching, if this is you, I want to know, how do you feel about seeing the doctor? Are you totally cool with seeing the doctor? What do you think? Samantha, you're just saying on Facebook, I think it's the fear of getting bad news. Well, you might be onto something there. Okay. One of you mentioned at the beginning of this live, you said, I have to keep nagging my husband to go. He doesn't want to go. And that's not uncommon. So what's going on? Well, there's a number of things, right? Samantha, you mentioned fear of bad news. I do think there's a lot of men and women that are actually just nervous about what they're going to be told. And I said men and women. I know plenty of female patients that sometimes avoid me because they're afraid of what I'm going to say about their lab work, about their tests, about this or that. They're afraid of hearing bad news. And I think that applies to men as well. So Samantha, I'm glad that you said that. Trudy, you were watching from Trinidad. Hello, it's good to see you. I think other reasons. The man in particular might be uncomfortable with his doctor. Okay, if you have a doctor that you're not comfortable with, or you don't like, or you don't feel like you can talk to, well, that would certainly be a reason, right? Why you may not want to go to the doctor. Also, there are some times where men doctors don't want women doctors, and they may feel like that's the only option or that's the doctor they have. I always say this goes both ways with women, female patients and male doctors, and male patients and female doctors. It's important to choose the doctor that's right for you. So don't feel like you can't exercise that choice, okay, and make a decision about not only the gender, if that's important to you, but the style of the doctor, making sure that you can trust them, that you feel comfortable with them, and all that good stuff. Let's see here. Now, this is something I thought was really interesting. Cleveland Clinic commented that 41% of men in their survey were told as kids that men don't complain about health stuff. Does that sound familiar to you guys? Like, is that something that you've been told, something that you've heard, et cetera? And I'm wondering, if that's a lot of it, where there's a little bit of sort of a masculinity that's associated with seeing the doctor or health care, that if there's something wrong with you, and by the way, I don't think of it as something wrong with you, but if you have a health issue that maybe some men feel like it's not a masculine thing to have, or that, they shouldn't be going to the doctor. Others, 65% of these men in this study said they prefer to self-diagnose themselves. Well, a lot of people do, and I kind of wish people wouldn't, because self-diagnosis can certainly get us into a whole hill of trouble, to be honest with you, being very honest with you about that. But it sounds like there are some men who would rather actually kind of do a guessing game or a Google search or whatever and try to figure out what's going on with themselves rather than seeing a doctor. Again, that's a bit dangerous, and I would advise not going down that road. Let someone help you figure out what's going on with your health. Now, this is something I think is interesting. Now we're talking about why men don't want to go to the doctor. We've already established that in many cases, surveys have shown that men don't go to the doctor maybe as much as they should, or don't like to go to the doctor often in many cases. But there's also, I think, some men who may feel a sense of shame or embarrassment, or they feel uncomfortable, or they feel judged, whether it's about weight, whether it's about Sexual matters, issues as we call them below the belt, okay? Whether it's about STDs or sex or erectile issues or what have you. Maybe there are some men that feel very uncomfortable with their issues, or they may feel judged, okay, or embarrassed, or a sense of shame. And it doesn't have to apply just to that. It could be regarding diabetes control or cholesterol or blood pressure, okay? And then, the last thing is what I just sort of implied also plays a role, which is this below the belt type stuff, is that I think there are a lot of men. I've had men say to me, my male patients say, look, Dr. Caudle, I'm just a little nervous. I've not had a woman doctor, or I'm kind of nervous talking to you about this issue because you are a woman. That has happened to me before. Absolutely. And so I do know that that can happen with both men and women. So there are many different reasons, I think, why men, in some cases, may not feel comfortable getting to the doctor. Okay. But I think the question then is, so how do we get our men to the doctor? And I say our because we all have some man in our life somewhere. Even if it's not a husband or a partner, it may be a brother, it may be a father, it may be an uncle, it may be a neighbor that we're really close to. We all have men in our lives, coworkers, what have you. What are things that we, whether it's women or other men, what can we do to help men feel more comfortable getting to the doctor? And honestly, men, I want you to tell me, what do you think? And actually, as I look on the comments, it's really interesting. I'm actually seeing a lot of comments from women on Facebook. I think maybe even more than men. So, it's interesting. Although Julia or Julio, you said too busy taking your family to the doctor. So maybe you're busy taking the kids and everyone else to the doctor and don't have time to go to the doctor yourself. But it's what's really interesting with this is I'm seeing, and maybe there's fewer men on this live than there are women. I don't know. Maybe we women are the most interested in finding out why our men don't want to go to the bathroom. Don't want to go to the doctor. I don't know why that was on my mind. I don't have to go to the bathroom, by the way. But why our men don't want to go to the doctor, I don't know about that either. It's sort of interesting. So let me try to pull up and see if I can find any more comments. Leslie on YouTube, you said men are scared to go to the doctor. And that is something that I do think certainly may be the case for a lot of people. So let's see here. Another, Leslie, you also say if there was some maybe liquid encouragement, men may feel more comfortable going to the doctor. Sure. But we don't want a whole bunch of inebriated men in the doctor's office. That's for sure. So Elder, you say, I really don't know why we as men hate going to the doctor. I'm curious to know if there's a difference between black, brown, and white men. So is there racial differences with who doesn't like to go? Elder, you say you regularly check in with your doctor, which is great. You're proactive. I love that. Let's see here. But you say you haven't done your annual checkups in a while. But you know what, Elder? I mean, first of all, I applaud you for all that you're doing. And it sounds like you're seeing your doctor. There's a lot of people who haven't seen their doctor regularly in a while because of COVID. So that is certainly understandable if that is used. Just a reminder for all of us to make sure we're getting our checkups. I'm actually going to the doctor tomorrow. One of my doctor's appointments, my routine sort of preventative care appointments. And it made me think of this topic, which I've been wanting to talk about. Philly, you say men need support from their other half to go see the doctor. I kind of believe that. And Leroy, you said you think lady doctors tell you more about your health than male doctors. That's interesting. Do you guys feel that way? Let's see here. What else? Ina, you said your husband's always self-diagnosing himself. And Papiti, you said specifically people of cultural backgrounds can't express certain issues or may not be able to express them. That's really, really interesting. So maybe there's some cultural aspects to this, as others were mentioning, or racial differences. Let's see here. Basma, you said your husband won't take a day off to do his annual checkup, not even a few hours. Let's see here. What else have we got here? And here's a man who says he goes to the doctor. Letterick, you always go to the doctor every year. I love that. Love that. Okay, so there's a lot of things here, right? And interesting, last thing I'll read is Sharon. You said your husband will always Google issues or talk to his pharmacist, but not visit a doctor. So it's interesting. All right, so let's talk about how we can help encourage our men to get to the doctor. And men, maybe these are things that will help you get to the doctor if you have not been in a while. And by the way, this is a heads up for all of us to make sure we make appointments to go see the doctor. I'm going to get a preventative checkup tomorrow. Full disclosure, I'm going to my GYN. It's time. So I'm definitely going. That's in the realm of preventative medicine. Kind of like you see your family doctor, kind of like you see your dentist, kind of like you see, or a child would see a pediatrician. So this is super important. So how can we help? First thing is women, and I saw this recommended in a few places, that perhaps well, let me just be blunt. Some articles are saying women or significant others, if it's a male partner, whomever, don't nag men about not going to the doctor, which I thought was really interesting. Because I thought it was really interesting because I have had patients in my office, husband and wife, or male, female, who are partners, etc. And the man is there because he says the wife nagged him. So I have seen where it's worked and he's ended up in my office. But maybe nagging doesn't work so much. Men, you'll have to let us know. Does nagging work? Does it not? But according to the articles I read, they're saying don't nag a man about going to the doctor. So there you have it. But how can we express the need to go to the doctor? Well, I think one of the ways to do it is to do it in a caring, concerned manner, from the vantage point of I'm concerned about your health, or I want you to live a long, healthy life, or, what happens with you ultimately affects me and our family. And I want to make sure that you're healthy, trying to approach it and the importance of it from a holistic point of view and from how it affects the whole family, and why it so matters to you or the partner of the man who wants him to go to the doctor. Okay. So something to do there. Also, if you have a partner, whether it's a girlfriend or boyfriend, maybe schedule your doctor's office visits at the same time. That way you're maybe going in the car at the same time. You don't have to sit in the office visit together, but some people do. I always call them twofers when I have couples in the office. I see one person and the other sitting in the chair and one's on the table and they swap, So it can be a very efficient way to see your doctor, but you don't have to be in the same room at the same time. Some couples prefer not to be in and honestly, I've sometimes had brothers and sisters come, not necessarily to talk about personal issues, because that doesn't usually happen so much where brothers and sisters will be in for those types of issues. But I have seen a brother bring his sister in, and these are adults. When the brother was concerned about the sister's, bereavement process, she lost her husband, so the brother brought her in. Also, some depression issues. I saw another brother-sister combination where the sister was concerned about the brother's alcohol drinking. So remember, you can have a support system in one of two ways. One, someone can come with you, be there with you, okay, be in the office with you. Actually, three ways. Someone can come with you to the doctor's office, but not necessarily be in the room. They could be in the waiting room. Okay. Maybe they just ride in the car and they're with you on the journey to talk to you on the way there and on the way back, but they sit in the waiting room. Or the other option is, you make appointments back to back, and, you and your partner, couple, whatever, you are in the doctor together and you swap. Okay. So those are some ways that it can be helpful. Also, finding a doctor that you like. I can promise you this: if you're not crazy about your doctor, no, whether you're a man or a woman, if you're not crazy about your doctor, you're not going to want to go. No, man or woman, you won't want to go. So finding a doctor you like may be a big part of this journey for going to the doctor more regularly. So that's one thing I wanted to mention. Also, finding a doctor with convenient hours. If your doctor, you can never get in to see them, well, you won't ever get in to see them, right? If their hours, if they never have weekend hours or evening hours or what have you, well, and you work all day long, well, of course you're not going to see the doctor. So maybe switch to a place that has more convenient hours. I work this Saturday in my office. We do Saturday hours once a month. We do evening hours, etc. So that's important, by the way. Also, and by the way, thank you guys so much for the stars. I see you guys sending stars on Facebook. I so appreciate it. And on YouTube, thank you so much for the super chats and super stickers. And I also appreciate all of you guys sort of jumping in and letting the rest of us know, kind of what's working for you, what's not working for you and your family. If you're a man, how you feel about all this, any suggestions that you have. These are very, very helpful. So just wanted to stop in and say that. The other thing was, if you have a man in your life who does not want to go to the doctor, I think it's important to find out why, right? We can't assume it's any of the things I've already talked about. We don't know. What if it's something totally different? Okay. So if there's a man in your life who doesn't want to go to the doctor, even a child who's, find out, why don't you want to go to the doctor, or what makes you uncomfortable, or what don't you like, or what's problematic, so that hopefully those issues can be addressed. Okay. And then let's see here. One of the articles I read, and I'm not sure, I can't remember which article it was saying that sometimes, women often are the people who sort of manage the household stuff, but also the healthcare aspects of the family. So women are often the people who make the appointments for men and children, who often take children to the appointments. One article suggested that maybe having the man in your life take the kids to the appointment if that's an option, so that he gets accustomed to going to doctors and the process and the procedure, so it doesn't seem so foreign. That's an idea that might apply to some of you. And then, of course, look, have somebody make the appointment for you if that's the easiest thing to do. Guys, going to the doctor is so, so important. You might wonder, how long do you need to go? Well, look, you need to go at least once a year. Ooh, there's thunder happening in Philly. Ooh, that was big. You need to go at least once a year if you're an adult. Certainly, kids tend to need to go a little bit more than that, depending on what age they are for the need for shots and stuff like that. But at least once a year as you get older. If you have certain medical conditions, you'll need to go more often than that. So my diabetic patients, I see every 3 to 4 or 6 months, depending on where they are with this. Cholesterol, blood pressure may be the same, but it also depends on what's going on with their blood pressure, cholesterol, et cetera, or if there are other issues that are happening. Okay. So please keep that in mind. And remember, men, we care about this topic so much because, actually, men tend to have shorter lifespans than women. That is actually a fact. And also, men tend to suffer more from severe and chronic severe illnesses, heart disease, liver disease, et cetera. So, guys, we care. That's all. We care. We just want to make sure that you are healthy and that you are happy, and that everybody's healthy and happy. So, I see Dennis, who's one of my Dr. Jen superstars. Dennis, you were on YouTube. You said you think your hobby is going to the doctors. You have like 12 doctors. Well, then you know what? Then you are on top of it. If you have any tips for making sure that other men get to the doctor, please put them in the comments. But so I hope those tips will help. If nothing else, ladies and gentlemen, please use this session as a reminder to make your appointments. Ladies, make sure you make your GYN appointments, your routine doctor appointments, any specialist appointments. Make sure you make your dentist appointments. Men, go to your regular doctor, go to the dentist. If you wear glasses, make sure that you're seeing the eye doctor. As COVID is getting better, and thank God for that, we're able to do more than we were before. Make sure you're getting your preventative screenings. And ladies or partners, ladies or men, whomever are partners or friends or family or whatever of the men that need to get to the doctor, let's do our best to try to make it comfortable for the men in our lives and the men that we love. Guys, thank you for all the stars. It's great to see you. It's nice to talk about something other than COVID. We are going to be doing lots of videos about other non-COVID things as COVID gets better. We'll still do COVID stuff, of course, as we need to, which we will still need to. But I think I'm going to move my Friday Night Live to Thursdays, and we'll do Thursday and Monday. So I hope that works for you guys. If you have suggestions for other days of the week that you think may be better, let me know. For those of you who are part of my Dr. Jen Superstars group, that's my membership group. They get special perks. They get merchandise discounts. They get a private live, and we do theirs on Wednesday. So consider joining if you haven't already. If you guys have not liked and followed my page, please do so you can get videos, hit notifications, get notifications so you can get updates on videos and stuff like that. Write in the comments about the doctor situation. Let's share with each other so we can all get ourselves and other people to the doctor. Guys, I really hope this was helpful. For those of you on YouTube, thank you for joining me. And make sure you subscribe to my channel and click the little bell if you have not. Guys, I'm Dr. Jen. I love y'all, and I'll see you soon. Are we live?